Hey guys, welcome to my channel. This is Mehak and here in my channel I discuss all the information related to nursing education. And today's topic which I'm gonna share with you is related to pediatrics is Bartter Syndrome. What is Bartter Syndrome? Bartter Syndrome is a group of very similar kidney disorders that cause an imbalance of potassium, sodium, chloride, and related molecules in the body. In some cases, Bartter Syndrome becomes apparent before birth. Now we will see the classification of Bartter Syndrome. Renal tubulopathy because certain small tears within the kidneys are affected. A salt wasting disorder because some affected individuals excrete excess amounts of salt. A salt losing tubulopathy, a channelopathy because the ion channels in the kidneys are affected. Some common symptoms may include muscle weakness, cramping, spasm and fatigue, polydipsia, polyuria, nocturia and dehydration. Now we will see the characteristics of Bartter syndrome. Some affected infants may have characteristics, facial features including a triangular shaped face, prominent forehead, large eyes, prominent pointed ears, and a pouting expression because of drooping of corners of mouth. Affected infants may fail to grow and gain weight as would be expected based upon age and gender, failure to thrive, growth delays and growth retardation may be seen as affected children age and final adult height may be shorter than would otherwise be expected, short stature. This is a picture about Bartter syndrome in which children are shown having Bartter syndrome disease. In some individuals who experience significant electrolyte imbalances where complications such as irregular heartbeats, cardiac arrhythmias, or muscle weakness, paralysis may develop. Although rare, if untreated, these cardiac arrhythmias can potentially progress to cause sudden cardiac arrest and potentially sudden death. Patients with Bartter syndrome type 1 and 2 typically have elevated levels of calcium in the urine, which can lead to deposition of calcium in the kidney, which is called nephrocalcinosis. In mild cases, there may not be any associated symptom or minor symptom, including blood in urine, vomiting, or fever. Affected individuals may pass stones made up of calcium. Calcium build-up calcification in the kidneys may eventually affect kidney function. In Bartter syndrome types 4A and 4B, affected infants cannot hear from birth due to an impaired ability of auditory nerves to transmit sensory input to the brain, congenital sensorineural deafness. In some cases, cognitive and motor development is also affected, and affected children may experience delays in reaching certain developmental milestones. This is likely related to degree of. Thank you all for your attention, and if you have any questions, you can ask in comment section.